All right, Cam, thank you. Well, we are in the middle of Breast Cancer Awareness Month. It also happens to be National Physical Therapy Month, and we're going to talk about how those two things can intertwine.
Yeah, today we have a 9-year survivor with us. This is Julie Lombardo, who is also the owner of Capital Physical Therapy in the Madison area. Thank you so much for joining us.
Appreciate you having me.
So you've been on quite a journey. So tell us, how did you discover that you had breast cancer?
Yes, okay, that was 9 years tomorrow, by the way.
Wow,
Yeah.
goodness.
So, yes, I did not have a lump, but I did see a fullness in an area that hadn't been there. So I went to my doctor and I went to her and she said, well, you hadn't had a mammogram in like a year and 4 months. So we got that and was diagnosed with invasive lobular carcinoma. Wow. So yeah, a scary road, very terrifying for many people. I had a bilateral mastectomy. They took 4 lymph nodes, and they found 3 to be positive. So I had to have an additional surgery to take 16 more nodes, followed by a 6-week course of radiation, and then on tamoxifen medication following that. So a long road. And part of the tie with physical therapy was what I was noticing while I was going through my care was that I was having range of motion loss, issues, and I had, axillary cording down my arm, and I had posture changes and weakness and weight gain and cancer-related fatigue and all of these things physically that so many of us go through as survivors. And what I was doing was treating myself as a physical therapist. And so one of the things that I noticed was no one was talking about it during my care. And so I went kind of on a mission to discuss this with area physicians and Gilda's Club, and really get the word out. And that was kind of my mission the following year, is making sure that people know that that's the standard of care, is adding physical therapy, so people don't have to navigate these complexities on their own.
So a really important part of recovery for breast cancer patients, and you wanted to show us some of those exercises. We want to make sure we have time for that.
So a couple of things that I would have you do. I'd normally have you standing, but if you're a patient of mine, and even the people at home, go ahead and put both arms up. I'd want to make sure in your care, can you get your arms all the way back behind your ears? Okay. And then the next one, I'd want you to go out like a snow angel. I'd get you against the wall. And then if you can go all the way up, against the wall without pulling forward, so your range of motion is good. Another one is the goal post position. So if you're here and you're back up against the wall, then you're in a pretty good spot. If you're finding that you can't get back there, or you're pulling up, off the wall and you can't stay on the wall cannot get your arm all the way back, those are times where you should be advocating for yourself and asking for some physical therapy help. Those 3 things are a good screen to do on your own. And also, if you cannot get back to the things you love to do, I love to water ski, I love to downhill ski, and I love to weight lift. And if you can't do the things that you love to do pre-cancer, then a physical therapist is the person that you need to be contacting.
And you really need all of those things to kind of get through a recovery process.
Yes, absolutely. Yes.
Okay. Julie, thank you so much.
Yes, you
for
bet.
sharing your story.
Yes, appreciate you having me.
More